So, hello everyone, welcome to the Royal College of Physicians and Surgeons of Glasgow's Medical Heritage Series. If you haven't joined us before, each year the Heritage team at the college pulls together a programme of events focused on all things medical history. And although we can't quite welcome you in person to the college today, we are thrilled to be streaming to you live from our beautiful library at our home in 242 St Vincent Street. So hopefully that gives you a flavour of our little home here and where you can visit us once things are a bit more settled and normal. Today we are reflecting on themes of health, happiness and well-being through the lens of our beloved Mearnskirk Collection. And I truly mean beloved. And by the end of the talk, I think you will be just as enamoured with the collection as we are. The Mearnskirk Hospital collection was one of the few pre-existing archive collections that we used in our Words of Hope and Kindness exhibition. A growing collection of books, archive items and objects representing the ways in which empathy was conveyed and communicated within the medical profession during the COVID-19 pandemic. Self-care, well-being and kindness to ourselves and to others were consistent themes during the pandemic and are considered central to our health and well-being. Yet this ethos has a long history. And with that, I'm delighted to be joined today by my colleagues Claire Harrison and Kirsty Earley, who will be giving us an exciting whistle-stop tour of the Mearnskirk Hospital collection and its history.
Thank you very much, Kristen, for that warm welcome and introduction. So, as Kristen previously mentioned, my name is Kirsty Earley. I'm the Digital Heritage and Engagement Officer here at the college, and this is my colleague Claire Harrison, who's Library and Heritage Manager. So to start off the event, we are going to give you a bit of background on Mearnskirk Hospital and the collections that we hold in our archives that are actually relating to the hospital. So this will hopefully give you some insight into what life was like for both staff and patients at Mearnskirk Hospital. So the hospital was based in Newton Mearns, which is a town, if you don't know, it's a town just southwest of the city of Glasgow. I'm sure most people know where it is. But in case people aren't local, just southwest of the city of Glasgow. It was opened in 1930. It'd been kind of in the works for a few years before that, but it was officially opened in 1930 as a children's tuberculosis hospital. And the hospital actually ran until about the 1990s. Undergoing several changes in response to the different changes in public health. So, for example, response to the Second World War, they admitted soldiers who were undergoing treatment, and also admitting patients who had polio in the epidemic soon after the Second World War. However, it originally started as part of a scheme for the prevention and treatment of tuberculosis in Glasgow. So tuberculosis, also known as TB or consumption, it's an infectious disease that mainly affects the lungs, and it's been a problem in the UK, the previous century, with many cases occurring in overcrowded housing conditions in different cities in the UK, so especially Glasgow. So sanatoria were established in countryside locations where there was plenty of space and plenty of fresh air, and a bit of a distance away from these busy cities. Mearnskirk was able to accommodate about 500 children under the age of 15, all with tuberculosis and who may be requiring orthopaedic treatment. So although TB mainly affects the lungs, it can spread to other parts of the body, including bones and joints. So this could cause deformities and mobility issues, which were actually very common amongst patients at Mearnskirk Hospital. The first superintendent of Mearnskirk was a man called Dr John A. Wilson, who worked at the hospital from 1929 until his death in 1946. Although a physician by trade, his true passion was in bacteriology, and he devoted a lot of his career to trying to understand tuberculosis. He was very kind and he was a very cheerful man as well, who cared deeply for his profession, staff and patients. To quote his successor, Dr Alexander Dale, Wilson loved his hospital and everyone in it. It was his kindness and care that established the spirit of Mearnskirk, which continued to thrive even after his death. So that's a bit of a background on the hospital. I'll pass to Claire to talk a bit about our collections relating to the hospital.
Thank you.
So what I'll do is I'll give you a very brief overview of what our collections as a whole actually are. So we obviously have the collections of the college, so that's all the records in the day-to-day business of the college. But alongside that, we also have records that relate to practitioners. So for example, Joseph Lister, who's the father of antiseptic surgery, William McEwen, one of Glasgow's, UK's, world's greatest ever surgeons, and Ronald Ross, who did a lot of work on malaria and won a Nobel Prize for it. So it's quite a varied archive in that way as well. But then we also hold records of local medical societies and also local hospitals, which is where Mearnskirk comes into it. And a lot of those hospitals are no longer in existence. And again, that is true of Mearnskirk. So at the top of the slide there, you can see the funny RCPSG 52. And what that actually refers to is the number of the Mearnskirk collection. So if you ever come into the archive and do any research for this, which you are always more than welcome to do, and you wanted to access the Mearnskirk collection, it's all under number 52. And underneath that, we've just popped the link in there for the catalogue. So you can actually go and search the Mearnskirk collection, have a look what's in it, have a good nose around and see the kind of things you could see in it. The collection's entirely catalogued, so it is a good representation of what's in there as well. The Mearnskirk collection itself has been a part of our collection since 2000, so it's been in our archive for quite a while. And it's actually donated by the niece of doctors Alexander and Elizabeth Dale. So it sort of relates to their involvement with the hospital. Dr. Alexander Dale started out in the hospital in 1929 as an orthopaedic surgeon, but he was also the assistant superintendent to Dr. Wilson that Kirsty mentioned earlier. But he eventually takes over the role of superintendent in 1946 on the death of John Wilson. And that's a role he's in until 61. So he has a good 30 plus years working at the hospital. Elizabeth, his wife, she qualifies and works as a doctor as well until her marriage, which is quite common at the time. You work until you get married and then that's it, your career's done. No, not quite. But she does, interestingly, come back to Mearnskirk Hospital when her husband becomes superintendent, and she takes on the role of looking at the charitable side of the hospital. So really looking at the ways the hospital can raise money, but also improve the lives of the patients as well. The collection itself contains all the things you'd expect to find in an archive collection. So there's letters, there's copies of articles that have been written, there's the ephemera and newspaper clippings. There's also bits of personal details about Alexander Dale, his war service, for example. But the big bulk of the collection is actually made up of photographs. Lovely black and white photographs, hundreds of them. Don't know how many in total, but it is hundreds. And they date from the 1930s through to the 1960s. So the period the Dales are both there. And they're a great record of life in the hospital. And I think it's fair to say a true staff favourite as well. And that's because the collection is so joyful, which isn't something we get to say very often about our hospital collections. They're interesting, they're fascinating, they're important, but they're not always joyful. And that's because there's a real focus in the photograph collection on happiness in the archive and the events that went on and the hard work that the staff put into creating a happy environment for its patients, both the children and the adults. It carries on with the adults as well. But I think Kirsty's going to talk a little bit about perhaps why in Mearnskirk happiness would be quite such an important thing as well.
Yes, yeah, definitely. Excuse me. So yeah, let's have a look at what sanatorium life would have been like. So for any patient in a sanatorium, but especially for children, it would have been quite challenging. So the idea around sanatoria at this time for treating tuberculosis was simple. Patients needed rest, sunlight, fresh air, and food. This was a time before the use of antibiotics as a mode of treatment for tuberculosis. That didn't come until later in the 20th century. So the pavilions of the hospital, a picture of which you see here, were designed in a very particular way to allow maximum sunlight exposure into the wards and easy access from the wards to the outside grounds for the patients. So for example, the pavilions were built facing the southwest, and each ward had a glass veranda. and you see the doors there in the building in the photograph. These would have been opened for easy access, and patients would have been wheeled out on their beds to get that fresh air and sunshine. For those that were particularly affected by tuberculosis and had quite a severe bout of the condition, most of their days would have been spent confined to bed, which would have been incredibly difficult, incredibly isolating, but you can imagine for children who just want to run about and play, incredibly boring. And this could have been months at a time. On top of this, they were miles away from family and friends. Potentially they're all by themselves, but without knowing anyone. And these family could visit though. Visits were allowed on Sundays, and for some, that actually would have been difficult for the family. You think out in the countryside, the distance, the public transport actually would have been quite difficult for families to visit. So life in a sanatorium would have been incredibly challenging most of the time, even though the photos may say something different. But I'll pass on to Claire to talk about actually what the staff did to kind of brighten the experience.
Yeah, so we've called this next slide remedies, but you're not really seeing remedies in the pictures as we would think of remedies in hospital. So not your traditional treatments and your procedures. What we're looking at here is really how hard Mearnskirk worked to bring just a little bit of fun, a little bit of change, a little bit of variety, and a little bit of happiness to the children's lives as well. It was a huge part of the Mearnskirk culture. There are certain events that happen every year and they always celebrate. So Christmas in Mearnskirk is a big deal. We have lots of photos in the collection that relate to Christmas. And the first picture you can see on its own, it's just gorgeous. It's Christmas. This is a little girl getting a doll. But interestingly, it's not staff with her there, that's her mother. And that was a huge part of the Christmas events, as well as that family were invited to these big events as well. And, you know, there'd be parties, pantomime sometimes. That could be visiting companies coming in, or the kids themselves would put pantomimes on. We have photos of them wearing little costumes. We've even got programmes that they made, which is really nice to see. And then obviously another big thing about Christmas is Santa. Santa did visit the wards. Santa would sometimes be a member of staff, or even occasionally a celebrity would come in and be Santa, which actually leads nicely onto the pictures on the far right. So this is Frankie Vaughan and Jimmy Logan visiting the wards. And that's quite a common thing as well at Mearnskirk. I think we think celebrity visits are perhaps a new thing in hospitals, but this is going sort of right back to the 30s, 40s, 50s, 60s. Mearnskirk was really embracing that. And many people visited. Some of those we perhaps don't recognise the names anymore, but they were big names at the time. The film star Beatrice Campbell, Judy Garland, huge name. She didn't go to the wards, but she was involved in some of the charity work and came over. And then perhaps most famously of all, Roy Rogers and Dale Evans came to visit the wards. There is a rumour that Trigger the horse went as well. Trigger was definitely in Glasgow, but we don't have any photographic evidence that Trigger actually came to the ward, so that remains a bit of a mystery. But then also in the middle, what you can see there are day trips. So this is actually a chance for the children to get, those that can, to get away from the wards. And a big part of the day trips is the idea of fresh air. So it's very often to the seaside, although that's not always the case, but they did at least once a year get a trip to the seaside. Ayr and Troon are the big favourites. And some of you may have heard of Taxis to Troon, which still happens today. It was very much part of York Hill. Actually is a Mearnskirk thing. We have some wonderful photos of taxis and all the kids going off in the taxis to Troon as well. The idea of fresh air stuff also moves into the big space they've got in Mearnskirk. So they had huge grounds, which meant that they could hold galas in the ground. Garden fetes were really common, and just playtime as well. There was a lot of outdoor play. So it's the idea of fresh air and fun as well. If we just have the next slide, please. So what Kirsty and I are going to do now is we've just picked out a few of our favourites, and that is really difficult to do because we do genuinely love this collection. But I suppose I will start with top right, which actually is one of my favourites because of how it ties into one of the other photos here. So this is a very talented dog that is at one of the garden fetes in the 1950s, and he's quite happily walking the tightrope there. And the reason I actually love that photo is because if you look at the picture on the far left, which is my official favourite photo in the collection, that is the same dog visiting one of the little girls on the ward, so very early pet therapy there. But I think that really sort of encapsulates Mearnskirk in that they tried the best for all the patients. So there were many patients that couldn't go out and enjoy the outdoor activities, but they still tried to take some of that into the wards with them. So there's the dog visiting the little girl. And then just, why not put some other dogs up there as well? So there's Buller the dog that belonged to the groundsman. He's the one sitting on his own by the Christmas tree. And then we have the big St. Bernard visiting at Christmas with Santa. So not a reindeer, you get a St. Bernard instead.
It's a better trade, yeah.
So I think, Kirsty, you've got some to show?
Yeah, I probably can't pick a favourite, to be honest. There's too many. But I thought another thing that we see quite a lot, actually, is that play and those games in Mearnskirk. So toys, a simple thing, but they would have had a massive impact on the children that were there staying at the hospital. So there's countless photographs of children receiving toys and presents at Christmas, or from the celebrity visits that Claire mentioned, or even the other benefactors that visited the hospital. One of the main fundraisers who we've not mentioned, who I thought would be good to mention, is a man called Alfred Ellsworth. So he was a business owner of a confectionery business in Bridton. And he was a massive supporter of the hospital and was very visited often. He was often known to say when he came in the doors to Dr Dale, well, what do you want for your hospital today, Chief? He just was able to get them stuff and get them celebrity visits. So on those regular visits, he always remembered to bring gifts and to bring sweets as well for the kids. But as Claire mentioned, Santa was always sure to visit at Christmas. No one was left out. Families would bring presents. But also the children whose families couldn't afford presents or couldn't afford to visit, that's where the benefactors would step in and ensure that kids had pillowcases full of presents to make sure that no kid was left behind. And I just thought that was a really lovely thought. So you see on the left, a young patient with some dolls, you see some racing cars in the top right, and you even see a round of golf in the bottom. So there was a lot of activity, a lot of games. But to conclude, life at Mearnskirk for these young patients would have been challenging for the majority of the time, to say the least. But many efforts were made and many special occasions were held to bring some light, some happiness, some joy to their stay. And I think these simple acts that are seen from the photographs in our collections truly represent that spirit of Mearnskirk. So thank you for that.
Wow, thank you so much, Claire and Kirsty, for that amazing, succinct but beautiful overview of the collections. I cannot believe that I've managed to go this long without seeing another picture of dogs. I thought I'd seen all the dog pictures, but apparently I had not, which just shows that I need to go back in again and look more deeply. For now, though, we are going to move swiftly on to our next guest speaker, and I am truly thrilled to also have Dr Mara Dougall with us today. Mara was awarded her PhD last year for her practice-led interdisciplinary research project, which combined creative writing with the history of medicine. This led to the development of her forthcoming novel, set in Oban in the spring of 1948, and as the country's health services headed towards nationalisation. Her work considers how historical fiction allows us to inhabit historical bodies and how place and space helps us fill in those blanks, particularly in medical settings. Mara, we're thrilled to have you. So excited to hear what you have to say. So whenever you're ready, we are all ears, and I will move over the slides.
Thank you. And yeah, thank you so much for having me. And it's been lovely to be able to look at some of the photos in the collection. So yeah, it was great to hear more about it from Kirsty and Claire as well. And yeah, thanks for the introduction too. I just today I just want to touch on some of of my research areas that are most relevant to the topic of the seminar today, thinking about how we understand historical hospitals, like Mearnskirk. So just to quickly kind of outline what these areas are on the next slide, I'm just going to do a bit of kind of context, give an overview of the history of hospital medicine, a very brief overview, and have a look at the production of medical professional identities, and then discussing this idea about overcoming objectification, before talking a bit about how I've remembered some historical hospitals as part of my research, and finishing with this idea of embodied empathy and how that can be used not only for research but also possibly self-care. So yeah, so to really appreciate like what was achieved at Mearnskirk, it's important to put the project into context in terms of the history of hospital medicine and how this goal of creating like a patient-centered focus on care that also incorporates kind of fun and happiness for staff too, was kind of outside and indeed at odds with kind of broader trends in the development of hospital and then laboratory medicine. So if we roll back slightly to the 19th century, and we see the huge rise of hospital medicine as as we know it today, observation excuse me, was a key practice of this new medicine, and its teachings, and so shaped the kind of knowledges that were produced. And then key theorists such as Foucault and Jewson agree then that the eclipse of, and this is quotes on the slide, the eclipse of bedside medicine by first hospital and then laboratory medicine represented a shift away from a person orientated towards an object orientated cosmology. So the rise of hospital medicine has really been directly linked to this idea of objectification. And physicians, so they traditionally treated upper class patients who held both like power and purse strings. But as Armstrong and other kind of theorists have noted, this dynamic was reversed in the clinic or hospital. Power was now with the medical professionals, whose status as professionals was increasingly rising as they were treating kind of relatively poorer patients in the first public hospitals. And this led Jewson, a theorist, to note that the hospital patient was, and this quote I think is on the slide as well, so the hospital patient was designated a passive and uncritical role in the consultative relationship, his main function being to endure and to wait. So in 19th century Britain, I think if we go into the next slide, great, there were hospital wings within district poorhouses and asylums, and the voluntary hospital system saw increasing numbers of infirmaries in the cities, and then the development of what we call cottage hospitals in rural areas. And changing public health concerns saw things like isolation hospitals and county sanatoria established to tackle kind of specific public health concerns, much as Kirsty's already spoken about. And all the while, the wealthiest could be treated at home or like in private nursing homes or private wings within some of the bigger infirmaries. Yeah, but leaping forward then to like 1948, the establishment of the National Health Service, famously free at the point of use, meant that healthcare really kind of became like a citizen's right, essentially. But the prior hierarchy of medical dominance within the exchange was maintained. And what's more, advances, and some really rapid advances in diagnostics and interpretation had real kind of social implications as well, shutting patients off from knowledge and ownership of their own health in some situations. So with every technological advance since the thermometer, physicians relied less on the testimony of the patient until we reached the point in the mid-20th century where Nicholson notes, and that's the quote on the slide here, that the position of the chart at the end of the bed facing away from the patient is symbolic of the way in which, as the century progressed, the basis of the understanding of disease was taken away from the patient and invested in signs and symptoms that were accessible and intelligible only to the doctor. So thinking about the 19th and early 20th century, there's this sort of kind of macro process of objectification going on through a hospital's spaces and systems and technologies as well. But it's perhaps at its most condensed and potentially potent in the power dynamic of the patient-clinician exchange and kind of Foucault's famous medical gaze concept. Yet this same patient-clinician exchange is where empathetic individuals have the opportunity to overcome objectification. So the medical gaze is consolidating and essential. It can also be consoling when empathy is suitably deployed. As Dougall points out, medical professionals are in a prime position to incite shame, but also to alleviate shame. So I really want to talk now a bit about empathy and the development of professional identities. And here my research has focused more specifically on nurses and surgeons due to the questions that their status raises around kind of gendered and embodied knowledge. And comparing the two also tells us something interesting about differing attitudes to emotion over the centuries as well. So nurses, firstly, of earlier centuries were perceived as slatternly and probably alcoholic creatures of the kind of Mrs. Gamp variety, if you're a fan of Dickens. And those are some quite strong stereotypes that existed until Florence Nightingale kind of remodeled them as ministering angels in the eyes of the nation. But in the early 20th century then saw a real kind of militarization of the profession that was directly linked to the fight for professionalization. And Starnes has pointed out that the change of image from angel to battle axe was just another step on the road to commissioned officer status and full recognition of the worth of registered nurses. So there was a lot going on at the time about the debate between registered and unregistered nurses. But yeah, I think we need to note here the language of angel or battle axe really reflecting the extreme poles that women are often restricted to within patriarchal systems, like Madonna versus Thor being the classic example. But the professional battle axe of brutal efficiency was constructed as an identity borrowing heavily from the detached attitudes adopted by other male-dominated professions. But surgeons, however, had first sought to eschew old associations with butchery and trade by distinguishing themselves on emotional grounds. So Brown has written of how Scottish surgeon and anatomist John Bell, he argued in the 18th century that a highly attuned sensitivity to the feelings of one's patient was a vital clinical skill. And his argument was that the surgeon's kind of embodied hands-on experience mattered because it was through this exposure to the physical suffering and mental distress of patients that the surgeon came to be formed as a man of kind of honest, heartfelt sensibility. But once the old Sawbones was accepted as a gentleman, and the kind of cult of 18th century sensibility gave way to hard-nosed Victorian rationalism, emotions were all but banished from the clinic for some time. So the proper place for emotion and the role of professional empathy is something that is still very much an ongoing debate. And Rachel Clark, in her 2020 medical memoir, somewhat contradicts Bell when she writes about how dissection has a numbing effect on medical students. She says, "You have seen and sliced and smelt too much." And for Clark, the detachment required within the profession carries the inevitable risk of inadvertent cruelty, as she calls it. And she goes on to note that the challenge for every doctor was to acquire sufficient detachment to be useful while maintaining one's essential humanity. But as students, no one ever discussed this with us. Indeed, doctors did not seem to acknowledge the emotional toll of their work at all, affecting instead to take it blithely in their stride. So she's really highlighting there as well the fact that empathy needs to extend to the self and self-care, which I'll come back to. But the fact that the struggle to kind of navigate this holistic approach to professional empathy and workplace well-being is still kind of ongoing today, really, makes the achievements of Mearnskirk all the more remarkable. And as the 20th century continued, approaches that sought to overcome objectification certainly evolved, but organic examples are perhaps more easily found in rural settings where the scale of buildings and institutions and centres of knowledge is more, it's less challenging. And as we see, so the slightly more interactive part of the session, but yeah, so just to get to the fun part, and hopefully you've all either got like a pen and paper or some kind of Word document open, so that you can get ready to do some writing. But if not, you're also welcome just to use these exercises as a time of reflection, and because they're going to be very guided. And don't worry if you've never done any creative writing or reflective writing before. I'm going to guide you through some very basic exercises using some photo prompts from the collection, just to kind of generate a bit of discussion for us as well. Firstly, I just want you to kind of take a moment to look at this photograph that's now showing. So this is obviously a ward scene, and it is from the Mearnskirk Collection. So I just want you to look at the whole scene, and then notice any particular details that you happen to be drawn to, but also just the kind of overall feeling or atmosphere that you can kind of get from this picture. So I want you to try and really immerse yourself in that scene and imagine what it's like to be there, either as a patient or a member of staff or a visitor, a celebrity visitor if you like. But what I'm going to ask you to do is a kind of listing exercise to get us started. So first of all, if I can get you to jot down or even just think in your head a few things that you can see. So what are the first things that you notice, and just actually name them in your head or write them down. Just the first things that you see. And I'm not going to give you too long, so I don't want you to overthink it. So hopefully you've had your thought. But next I want you to, again, either jot it down or just think about it. But what can you hear? So in this scene, what can you hear if you're inhabiting it? And it can be one thing or a few things. But just imagine what you can hear. And next, what can you feel? So if you're in this scene, are you touching anything? Temperature? What's that like? Clothing? What can you feel? And then the next one is my favorite one. So write down, what can you smell? What are you smelling in this scene? And it can be so evocative, like the memories of smell. So what would you be smelling in that scene? Lastly, what can you taste? Potentially a tricky one. I'll let you have the same as a smell if you want, but you might think about something else that you might taste in that scene. So that was really just a warm-up exercise to get ourselves immersed in the scene, hopefully. So to try and get you thinking more about how you might inhabit that scene more fully. To think about what is happening. So I'm asking you to take a bit more, slightly more of an imaginative leap there, and just think for a moment what might be happening in that scene. And don't need to think about it too much. It could be focusing more, thinking about the patient point of view or the staff point of view, but just what might be happening after the photo's taken even. So hopefully that, yeah, sorry, we can move on now, but hopefully that got you thinking a bit more about how you might inhabit a scene more imaginatively, taking that imaginative leap, so to speak. But moving on to part 2 now, and I just want you to kind of keep in mind this idea of kind of being open to the senses and sensory experience. And also for this part, I'm going to invite you to do what we call free writing, which basically involves starting to write and trying not to worry too much, if it even makes sense at all. But it's nobody's going to see it, so it doesn't need to be perfect. You don't need to go back and edit it. It's just a chance to kind of let your thoughts run on the page, or just in your head if you want to just reflect on it that way. But here we've got this amazing photograph, literally the poster children for the exhibition, and it's such a great photo of a trip to the beach. So I just want you to take a moment to just absorb the detail of the picture, but also just to kind of soak up that atmosphere of the scene. So if you're looking at that, just try and capture the detail, but also the kind of mood of it. And while you're doing that, I'm also going to invite you to just actually notice your own breath and the natural rhythm of each breath, and just even seeing if you can lengthen that ever so slightly so that we have a kind of nice deep breathing in and out again. So we take a moment to kind of reflect and pause. And you can even, particularly those at home, you could even close your eyes for a moment if you wanted to, or if not, then just allow the gaze to kind of soften and grow hazy, and take that moment to kind of notice your breath and any other sensations in the body. Maybe allow the shoulders to relax and the jaw to loosen, forehead or brow to soften. And I want you now to think about a beach that you know. So thinking of a beach that you know, think about what smells and sounds you might notice at that beach. And on your next inhale, you might lift the chin ever so slightly and imagine that feeling of sun on your face. And then if you open your eyes again, if you've closed them, and just back noticing your surroundings and noticing this lovely picture again, kind of full of the possibilities and joys of life. And I'm going to invite you now to just write either this beach scene that you see in the picture, either focusing on a patient's point of view or a staff onlooker, or writing about your own beach scene, so reflecting on somewhere that you know that's meaningful for you. So wherever you want to go, whatever moves you to write or reflect, just start putting some words together about your beach. And if you are participating in a writing format, then just start writing now and don't stop until I say so. Okay, but I'm going to time it for, we're going to try and write for a whole minute. So that's pretty abrasive noise to end a kind of minute of reflection on. But yes, that's obviously the minute up. So if you were writing, just finish the sentence or even the word that you're on, and hopefully some of you managed to get a few words down for that exercise. You might even come back to it to spend more time in it. But I'm intrigued to know what you made of it all, and also if you have any questions about anything at all that I've discussed. But I'm going to be a bit cheeky first of all and put some questions to you. So that my last slide was just some discussion points that if anyone was willing to share their thoughts, I'd be delighted to hear from you. But thanks again for your time. And I'll pass it back to you.
Oh,
Kristen.
Mara, thank you. I don't think I've ever felt so relaxed after
Not during an event. No.
After an event. I really cannot thank you enough for your insight in the history and and then that really wonderful conclusion to that talk that kind of gave us all time to reflect on what's been discussed over the past 40 or so minutes, and also gave us a real opportunity. I couldn't believe how visceral some of the tastes and smells that I was getting from each image came from. I don't really see myself as a creative writing person, but wow, did I want to explore that ward. So, but whilst you're all thinking or reflecting, I just wanted to kind of bridge the two talks together because there was so much commonality between what you were both discussing. And the first thing I kind of want to pick at is, Mara, you were kind of talking in your talk about medical professionalism and this kind of growth of medicine. So would you say that during this kind of time period, that sort of 19th into the 20th century, does the patient almost disappear from the kind of medical interaction? Because that's kind of what I got from it a little bit from your talk.
Well, I suppose partially maybe you got that because I was quoting quite a lot from Jason, whose paper is about the disappearance of the sick man. I guess it was that those ideas interest me about the kind of agency, patient agency, and their kind of role in the medical exchange was something that even isn't just theories that I've been interested in, but also it came out of themes that came up in oral history interviews as well. So that was even from like the 50s. So getting kind of quite far into the 20th century. But it kind of still depended on the patient as well, because that's kind of why I didn't have a much time to kind of go into it. But I think the kind of social standing and class still was a big factor in how that dynamic worked. But I had initially become very interested in it going like quite far back, and even thinking about the likeliness or not about whether physical examinations would take place and how that was so linked to a patient's social status as well, and the relative status of physicians as well. So it was interesting for me to kind of chart that a little bit during my research and seeing how with the professionalisation, it did, I guess, there's only so much power within an exchange, and the balance was kind of, I guess, quite more heavily skewed in the other direction then for probably quite a chunk of the early 20th century. But then it's been really interesting thinking about how that then has developed since. It's not so much my area of research that I know that much about, but obviously did, take an interest and touched on more contemporary experiences, both as from the patient view, but also medical professionals, and how kind of understandings and discussions around empathy have evolved or not in some contexts, or have kind of moved in different directions, and then taken us right up to today, where there's just really a lot of interesting debates around self-care and how we value, how much we value and appreciate the medical professionals treating us in these particularly difficult times.
Absolutely, and definitely over the past couple of years, kindness has kind of came out alongside burnout on an unparalleled level, and the way that the medical professionals that are caring for us care for themselves has become a really common theme throughout the pandemic. But from your talk, like I do, and from the kind of history I was looking in preparation for this, you do see an attempt to push towards like very objective, laboratory focused, clinical, like all of these kind of colder words, if we're going to be really emotional about it, these kind of cold, detached words. But then you contrast that to our collection. So Claire and Kirsty, in the grand scheme of our archive, how distinctive, or is the Mearnskirk Collection distinctive in our archive? Is it how does it compare to our other kind of either medical photos or just anything?
Okay.
I could say something. But
yeah. So we have lots of other photos of hospitals, of patients, but the Mearnskirk ones are very different. So most of our photos of hospital life are, we've just used that word clinical, they're very clinical. Yes. So it focuses on the staff a lot, but in very posed ways, so just before an operation. Or it focuses on the building, or maybe the equipment even. There's a lot of interest in the equipment that's used. And patients do feature, but it tends to be in a clinical sense. So it might be clinical photography in itself is a whole different medium, but you get that. So charting the progress of a patient, just photographing, how the case develops. But also then they'll be on the wards, but it's very much like the first image that Mara used. It's very clinical, very regimental. It's very about the wards rather than the patients. The patients are just more sort of there in the background. And that's what's so different about Mearnskirk. The patients are actually in the foreground. It's all about the patients. There's definitely the clinical side in the Mearnskirk collection as well. It's not solely the patient side and the joyful side. There is the clinical side as well. But even the staff photos for Mearnskirk are quite different. Even that's more like staff smiling outside, having a bit of fun, rather than focusing on the clinical setting, I suppose. So that's the big difference. And it is true. I don't think we've got any other hospital photo collection that has that side to it. And if it does, it would be a one-off, I would think.
Yeah, the difference here is it's not just a one-off either. It's a cult. Like as Claire mentioned, there's hundreds and hundreds of photographs, and countless ones are ones expressing joy or activity that would not be seen as kind of the everyday hospital activity, like the first image, the galas and the fetes and whatnot else. So it is quite unique in our archives and I think our collections as a whole, not just the archives.
And you did give us a bit of a kind of portmanteau, a bit of a because you had a section on remedies, and there I think quite a lot of us, myself included, would have been thinking you would be talking about therapies for TB, treatments, and things like that. Do you see those kind of treatments in the Mearnskirk Collection? I know you mentioned they're there at a certain extent. What were they?
Yeah, so we kind of deliberately avoided talking about the clinical side of it before this event. So sorry to mislead some people in case they did nothing. No, there was. So as we mentioned, TB can pass to the joints and whatnot, and you know, Dr Dale was an orthopaedic surgeon, so there was this orthopaedic focus at Mearnskirk with regards to TB. So there'd be, you know, surgeries and all the therapies that come with that. But there's you see aspects of physiotherapy as well at Mearnskirk, all different types of physiotherapy with response to TB and polio eventually. Heliotherapy, water therapy is one of them. They had exercise pools and water, and there's countless photographs of that and just general kind of movement. So a lot of crutches, a lot of that and whatnot else. So there was a clinical side to Mearnskirk, we just didn't mention it.
But it is interesting that tends to not be the huge focus of the archive, that it is more about this, you know, the spirit of Mearnskirk. You kept saying spirit of Mearnskirk, and we've seen in the research that is a thing that they use to describe the hospital. It's a holistic place. So I guess like this is just a general question for the table, perhaps again starting with yourselves. You know, what is this kind of relationship then to medicine and well-being at this time? Is it like, do they see going to the beach, is that a medical therapy, or is it fun? What are these kind of purposes?
No, this is where we're being kind of totally subjective, I think, in our answers, in that I would think, yeah, there is a mix of like, yeah, it's good that they're still getting fresh air and sunshine. But my main answer to that was, I think they just wanted to let them be kids. Mm-hmm. I mean, you think of the experience, they're not getting, this will be, and people who have spent that time in hospitals as children, that is what they remember about their childhood. So to give them those experiences of, you know, you get toys at Christmas, or, you know, remember that time that she didn't come, but like Marilyn Monroe came to the hospital, mate. The one day they didn't have the camera, and you know, or they wanted to give them memorable experience, but also especially the day trips and the toys. Let them be kids, because that will be something that unfortunately through their illness would have been taken away from them, I think. So I don't think we can say for a fact that it was a medical treatment. I would more heavily go on just letting them live.
No, absolutely. And Mara, do you see that in your research, like the hospitals in Oban? Is there a focus on kind of holistic care, on well-being? Is that reflected there, or is this quite a unique case in your experience?
Yeah, well, like, to be honest, the situation with the hospitals in Oban seemed to be like a lot of the focus was around the kind of care and the atmosphere. I guess like having that kind of like warmth and a kind of personal kind of touch to the care, where it's also, these are communities where a lot of people kind of, they're already quite connected anyway, or there's you know, different kind of networks. When people are coming over from the islands, perhaps, then they've got other, you know, connections, and somebody's auntie or wherever will like go and call up and visit them or whatever. But there are kind of earlier examples as well. One of the oldest hospitals, or the oldest hospital in Oban, was the Dal and Tart, which was the old poorhouse, the combination poorhouse initially, and they went through like lots of kind of iterations of what the type of patients that they had and how long they stayed for and what they did with them. And there was things like gardening, so a lot of that was like also quite practical as well, because they like grew food to eat, then they cooked it in the kitchen and they ate it. At one point, I've not quite been able to like get much information on this, but apparently they grew a lot of rhubarb, which they then sold to a jam making company.
Oh, nice. Yeah.
And then in the kind of post First World War, kind of interwar and then immediate post-war period, there was also a bit of a kind of rehabilitation unit attached that did things like crafts as well. So then there was those kind of elements that people, maybe don't immediately associate with hospital life or hospital activities. But yeah, and then there was we had the sanatorium on the hill, kind of overlooking the sea with its nice gardens, and it had pavilions as well where the patients could kind of be wheeled out on the veranda. So there was again that kind of fresh air and space was something that I kind of encountered a lot as well.
And they were so proud, Mearnskirk, of that kind of they would list how much high above sea level they were, and like that kind of like the fact that it was near Loch Lomond. They were really proud of being near Loch Lomond. And there does seem to be this kind of ongoing theme, even right into the 20th century, of space and of air and freshness. So, where do you think that's kind of coming from? Is it just because of the treatment, or is this kind of like a lasting thing from centuries ago where, it's all about fresh air, and fresh air has to be good for you, thereby it has to be in medicine?
With regards to Mearnskirk, I think that's quite a tough one to answer actually with regards to Mearnskirk. So we did a podcast on Mearnskirk not so long ago, and in our research for it, the kind of rabbit hole I went down was that kind of like, why fresh, why space? And I think some of the reasoning was just because, these kids are coming from really kind of condensed areas, especially in Glasgow, where they wouldn't have that space, and particularly the transmission of TB was airborne as well, so that closer kind of proximity to other people. So the larger areas and the fresher air, the cleaner air, it was less dirty, and a lot of it was to do with humidity as well in some places, to kind of, because through the air it would be in water droplets, so it's controlling the water content as well. So I think it's a mix of the science, but also just we all feel better with a bit of space. Who doesn't like a bit of fresh air and space? Fair dues, yes. I've not been in a sanatorium. I've not lived there. It will be different, but just getting away from a congested space would have brought some form of relief. And that's me talking more about the psychology side of it, I think, rather than anything else. But yeah, there was some science behind the fresh air and the space, but it's hard to find.
And Mara, you said that the architecture, some of the architecture that you kind of came across, it was almost designed and targeted towards sunlight and air. And could you speak a little bit more about that?
Yeah, so the old county sanatorium in Oban was then was briefly actually known as the county chest, and then by the time I was alive, it was the county hospital, but it was still always kind of referred to as the chest hospital, because I think that idea was so closely associated with chest complaints, even after it kind of stopped mainlining in that, because of just it kind of been set up for that. And they had these lovely huge windows until they started kind of leaking and very drafty as the building aged, and were just not fit for purpose for most of the 20th century probably. But they were, so they had built it with these very kind of high tall windows, maximum kind of light and air, and they also had the kind of opening of the doors out to the veranda to be able to kind of wheel the patients out. So that was some quite distinct kind of sanatorium vibes coming from that hospital. And the likes of the isolation hospital was more just its geographical location, because it was on the top of a hill right on the outskirts of town, so not near anywhere. At the time, like the nearest dwelling was a dairy farm at the bottom of the hill a little bit away, which is actually my parents' house now. It's, definitely got lots of connections there. But it was really interesting actually in the archives reading about how the poor dairy farmers had been banned from selling milk to the rest of the town for a while because there was initial concerns that they were taking milk, they were selling milk to the isolation hospital and going up there when they had all these kind of infectious diseases. So yeah, but they were able to make it work in the end.
Yeah, no, definitely. The kind of thing that I kind of kept thinking about going back to, and again, I can go on forever about this collection, but we see all of these photographs and everyone's just so happy and joyful looking, and it does in many ways sometimes Mearnskirk look like a great place to be. And then you remember that it is a hospital for the treatment of tuberculosis. So I just guess I wondered what your thoughts were on the kind of emotions that come from Mearnskirk when you look at the collections, or and archives kind of similar to this, and if it's maybe got, is there something to do with the fact that they're photographs, and what are the differences, I guess, between a photograph and then perhaps a written document? I don't know if Claire, you want to maybe speak to your experience of engaging with these collections and your thoughts on that?
I suppose photos just more immediate. And you're looking at happy faces straight away, and memories of your own, maybe. Reading documents, it depends how it's been written, I suppose. Like, if it was creatively written, you'd probably engage with it much more. But obviously it's a medical archive, so it's not creatively written, so it's not as engaging. So I suppose if you were reading about it, you perhaps wouldn't have the same response as you do as actually looking at the photographs.
Yeah, my not issue as such with the collection is the trustworthiness of photographs. I think, especially in this day and age, I think we can immediately just trust that is the true emotion that was felt by that person. But as I'm sure we know, in today's age of so much imagery and technology, half the time it's fake, let's be honest. And my initial emotions are always of joy with Mearnskirk, but there's this little niggling voice in the back of my head being like, aye, but what if the kid was just plonked on that bed and been like, smile.
But then in contrast, that we do have photos which we haven't shown today, which are kids just bawling their eyes out.
And I always go back to that, being like, no, I'm pretty sure.
Maybe there's a selection bias there
as well. Like there's kids crying at Santa turning.
I mean, Santa looked a bit scary in that photo.
There's a great one in an exercise bath, and they're not crying because they're in an exercise bath. They're crying. The cast from the local panto have come to visit them, and
they're terrified.
So yeah, I think there is inevitably an element of posing, but there's also kids, and it's not always easy to make kids do what you do.
But I think visually, I guess it depends on the way. To get really technical, it depends on the way your brain's wired. You can be really visually linked to your emotions, and seeing photos can just bring that out, like watching a film or seeing a TV show. But equally, writing can bring that out in you as well. So. Yeah, but the emotions definitely that we experience most of the time is a smile and a giggle. They're not emotions, but that's what happens when we get Mearnskirk out, which is just such a really nice change to what we deal with the majority of the time in a medical heritage collection.
Absolutely. And Mara, in terms of, it's not like photographs versus other documents, because we could then go into how everything's biased and subjective and there's no objectivity, etc. But in your experience, is there almost like a kind of rose-tinted glasses effect when you see photographs? Do you have to almost pause and kind of refresh yourself on where you are?
Yeah, I suppose you do kind of have to bear in mind that every kind of snapshot is selective, and it's for what were the factors in selecting that moment, that subject, that kind of thing, and just kind of keeping it in context. But I do think that you can't really get away from that, as social beings, we have that kind of immediate leap of recognition of seeing like another person in a situation or something, even if it's not one that we're familiar with. We can still relate to them as another human, and it's just even so that I guess that's connected to where I'm always taking empathy back to just the very basic experience of embodiment. Like, even though our bodies are all different, we all have one. And so there's always at some level of kind of, yeah, connection, whether it's in the past, no matter how kind of far back. But in terms of like other things, like I do love, I mean, it's been difficult in the past few years with archives not being as accessible in person. So lovely to be in here today. But I am a big fan of kind of, yeah, things that you can touch, and like kind of material history as well. So if it's a written document, I might not really be that connect, even if the text itself isn't the most engaging. Maybe the handwriting's telling me something, or the way the person has kind of, you know, tied or folded it, or if it's like a kind of black edged piece of correspondence. There's like all these other things that sometimes can just give you a kind of feel for it, and I suppose that's where I think I'm quite lucky in how I respond. I can be subjective, or I can be more kind of self-consciously subjective. So yeah, like I do enjoy working with archives in that way, and objects that maybe, you know, someone else has held that you're trying to connect with. So yeah.
What a beautiful way to phrase it. And then the way you engage with archives is so, you know, not unique, but it's a way of interpretation and of creativity that does, I think, unlock some of these emotions that perhaps we would hesitate to embrace at any other times. To just again though, just to thank Claire, Kirsty and Mara for joining us today. Just thank you very much. I'll applause on behalf of everyone. Thank you everyone for joining us. I really appreciate it. Remember, you can always find us at RCPSG Heritage on Twitter, or you can find us online. And yeah, please do pass on any writing prompts that you did today. And yep, thank you so much again for taking part. Have a lovely evening, everyone. Thank you.
Yeah, you too.
Thank you.